Fabulous. Thank you so much for such an interesting talk, Liz. That was brilliant, and it links very well onto my own talk that's coming up next. So whilst I share my slides, do remember that you can submit any questions that you have to the link that's underneath the screen. Okay. So here we are. So as I said earlier, I'm Rebecca Jones, and I'm a final year PhD student at the MRC Epidemiology Unit at the University of Cambridge. And today I'm going to share the findings from a recent systematic review, which looked to assess whether weight management interventions helped or hinder the mental health of adults with obesity. So the review findings that I'm sharing today form part of my PhD, which is the overarching aim to assess the impact of behavioural weight management interventions on mental health and to understand how we can better support adults with obesity psychologically during interventions. So my presentation today will talk through the key why, how, what, and so what questions. And this is going to be more of an overview talk, but the full review has been accepted at Obesity Reviews and is in press. So keep your eyes peeled for that for more detailed findings. So behavioural weight management interventions are the most common form of obesity treatment in the UK, and they're recommended by national guidelines across the world. These interventions are typically multi-component, and they target changes in diet and physical activity through behaviour change support, with the overarching aim to support adults with obesity to reduce excess weight, minimise health risks and improve health outcomes. Weight management services priorities are set to improve people's health by reducing risk factors without a sole focus on weight. But this is rarely the case when services are evaluated for effectiveness or when they're assessed for commissioning value. In addition, the research landscape provides good evidence for the effect of these interventions on physical health. However, there's limited and inconsistent evidence assessing the mental health related outcomes or unintended effects of behavioural weight management interventions. And this really raises the question, can we truly recommend an intervention to be implemented if we're unsure of how it's going to affect the mental health of those that we're encouraging to attend? So previous systematic reviews have aimed to assess the impact of weight management interventions on mental health, but these have had really inconsistent findings, as you can see on the slide. So the green arrows represent reviews that found beneficial effects for mental health outcomes, and the red arrows represent reviews either finding no difference or a detrimental impact on mental health. These contrasting findings make it extremely difficult to get a clear understanding of how interventions are affecting mental health. And it's made even more difficult by the limitations of the previous reviews. So previous reviews have applied extremely restrictive criteria, such as including only successful trials, limiting to diet only, exercise only, or CBT only trials. They've limited participants to what was referred as in the paper as uncomplicated patients only, including males only, females only, and vast majority of the reviews have studied a very limited number of outcomes. So in the process of developing our own review protocol, it was very important to us to address these limitations, particularly as we aim to provide a more comprehensive overview. So we'd identified there was a lack of an up-to-date comprehensive review investigating the impact of behavioural weight management interventions on a broad range of mental health outcomes in a representative sample of adults with overweight and obesity. So overall, we aim to assess the impact of current interventions on participant mental health, and we aim to determine if these effects are different depending on intervention or participant characteristics. So today I'm going to focus on sharing the main review findings, being the impact of interventions on mental health. And we assessed this at 2 time points. We assessed it at the end of the intervention and then 12 months after beginning the intervention. So the review process started like any other, which is defining the eligibility criteria. So when we defined the eligibility criteria, we kept the focus on study quality, representative populations, and replicating intervention characteristics to what's commonly delivered in Tier 2 weight management services in the UK. We did apply a few exclusion criteria, and this was to make sure that the review was deliverable and focused. We excluded papers that focused exclusively on participants with a physical or mental comorbidity, for example, all of the participants having a specific cancer diagnosis, and we excluded papers looking at pregnancy. We excluded eating disorder, surgical and pharmacological interventions, and we also excluded theses and non-English language papers so we could constrain the search and ensure that the review was achievable. So we completed the search on the 7th of May in 7 different databases, and after removing duplicates, we title and abstract screened just under 32,000 papers. We used confidence systematic review screening software, and we resulted in 43 papers meeting criteria for inclusion. The data was extracted from these papers using the modified Cochrane data extraction form and the Cochrane risk of bias tool. So then we moved on to data synthesis. The extracted data was meta-analysed by outcome, and meta-regression was applied where possible to identify the potential sources of heterogeneity in the results. We also completed sensitivity analysis to identify if risk of bias ratings influenced the overall findings, and we conducted stratified analyses to explore if the effect was different for key characteristics, for example, face-to-face interventions versus online-only interventions. So today I'm going to focus on the key meta-analysis findings, but I would recommend downloading the full paper to see the more in-depth and detailed results. So the exciting bit when we get to findings. So most studies that were in this review were conducted in the USA, UK or Australia, and the participants were mostly between 31 and 50 years, female, and with a BMI between 30 to 39.9. The majority of interventions provided education only, which may have been in the form of behavioural education sessions, online information, or behavioural counselling. Most interventions lasted between 2 to 6 months, and they were delivered face-to-face and one-to-one basis mostly. So when it came to meta-analysing the results, there were a lot of outcomes to be working with, and we produced 25 different meta-analyses for the different outcomes at the end of the intervention, with almost as many produced for 12 months from baseline. So evidently, this is far too many numbers and graphs to be able to show you in one overview presentation. So instead, I'm going to focus on sharing the key findings of the review and how they may influence future practice and research. So at the end of the weight loss intervention, we found that participants experienced small improvements in depression, mental health related quality of life and self-efficacy. There was little to no difference to anxiety, overall quality of life, self-esteem or stress. And there was too little evidence for us to be able to assess the impact on body image concerns, emotional eating, negative emotions, distress or satisfaction with life. And this is when compared to either an inactive or minimal intervention. 12 months after starting a weight loss intervention, we found the participants experienced small improvements in depression, mental health related quality of life, and self-efficacy again. We found little to no difference for overall quality of life, and there were many outcomes where there was too little evidence to assess the impact on. And these were anxiety, body image concerns, emotional eating, distress, and negative emotions, satisfaction with life, self-esteem, and stress. So overall, we aim to assess the impact of adult behavioural weight management interventions on mental health at the end of the intervention and 12 months after beginning the intervention. And we found that attending a weight loss intervention may slightly improve some aspects of mental health. But importantly, we didn't find any evidence that suggests that interventions negatively affect mental health. Although it is important to note that these meta-analyses assess the average effect of interventions, and it's likely that this isn't the case for all participants. What we really need is more high quality studies, especially when multiple different types of mental health outcomes are measured over longer durations in time, so that we can have a more clear understanding of the impact on mental health. So while the evidence suggests that on average mental health outcomes improve following a behavioural intervention, it's likely this isn't the case for all participants, and it's vital that we're able to identify those who are at risk of more detrimental impacts on their mental health, so that sufficient intervention can be implemented in a timely manner. We also need more studies with varying intervention characteristics to allow us to investigate whether interventions of different types are better than others for supporting mental health. And this is something that we did aim to do in this review. However, due to limited variability and few contributing studies, we weren't able to draw any clear and reliable conclusions. But all in all, it comes down to the fact that we really need many, many more trials to measure a variety of mental health outcomes over longer durations and transparently report the findings. So this work could not have been completed without my brilliant co-authors, many of whom are tuned in right now. So thank you all very much for your support with this project. And thank you also to my funders at the MRC for supporting this work. And thank you to you all for listening to this today. Remember to ask any questions that you may have by following the link underneath the stream, and then jot down my email on the slide if you've got any further questions or comments you want to come back to. Thank you very much.